Have you heard about antihistaminics? Have you heard about first generation antihistaminics, second generation antihistaminics? Antihistaminics. Now people are saying antihistaminics. So phenyramine belongs to antihistaminics. It is a first generation antihistaminic, antihistamine drug. What is the usual dose of phenyramine? What is the usual dose of chlorpheniramine? Why do we avoid giving first generation antihistaminics to people requiring high attention and work? Okay, I guess majority of you are here, so we are no longer stalling. First generation antihistaminics causes sedation. It causes wide variety of anticholinergic adverse effects. So we usually avoid giving first generation antihistaminics. The point I was trying to make was that when we add chlorine into phenyramine and we convert to chlorpheniramine, the potency of phenyramine increases. So a pharmacokinetic profile, pharmacokinetic property improves. Since the potency increases, by increasing the potency, the dose requirement decreases. The usual dose for phenyramine is 20-25 milligram, while the usual dose for chlorpheniramine is 4 milligrams, 2 milligrams. Anyways, we are talking about fluoroquinolones here. We are talking about fluoroquinolones here. So the first quinolone to be used was NALIDIXIC acid. It was used in the treatment, in the management of urinary tract infections, because a high enough concentration can be achieved in urine, and this high enough concentration is enough to kill gram-negative aerobic bacteria, but systemic uses of NALIDIXIC acid could only be achieved at the cost of toxicity, and a major breakthrough was achieved in late 1980s with the introduction of CIPROFLOXACIN, which is a fluorinated quinolone. An addition of this fluorine and modification of structure of NALIDIXIC acid gave us some beneficial effects, gave us a new group of drugs by the name of fluoroquinolones. Now, talking about NALIDIXIC acid, which is quinolone, again we are repeating ourselves. It is still available for the management of urinary tract infections, but it has limited therapeutic ability. You know why? Because systemic antibacterial levels are achieved at the cost of toxicity. So it has limited therapeutic ability, and there are a number of common adverse effects such as GI upset, rashes, neurological toxicity, and hemolysis. And because of widespread use of NALIDIXIC acid for such a long duration of time, there has been emergence of bacterial resistance. So NALIDIXIC acid is quite limited. This is the structure of NALIDIXIC acid. जरूरी नहीं है, इसको याद रखना आपको बिल्कुल भी जरूरी नहीं है ना? So sometimes NALIDIXIC acid can be considered as a parent drug for quinolones, for fluoroquinolone group of drugs, and it has a carboxylic acid moiety at position 3. यहाँ से इस नाइट्रोजन से कैलकुलेट करते हैं 1, 2, 3, 4, 5, 6, 7, है ना? यहाँ 7 स्ट्रक्चर पे अगर कोई फ्लोरीन अटैच कर देगा या फिर कहीं और पे भी अटैच कर देगा, then this will become a fluoroquinolone. This quinolone NALIDIXIC acid will get converted into fluoroquinolone. So structure of NALIDIXIC acid, it has a carboxylic acid moiety at position 3 and many new fluoroquinolones have fluorine at position 6 and a piperazine moiety at position 7. 1, 2, 3, 4, 5, 6, 7. I think is containing it, but again, the structure is not important for us. Now, these are some structures for fluoroquinolones. These are some members of fluoroquinolone group of antibacterial drugs: LEVOFLOXACIN, gemifloxacin, inoxacin, sparfloxacin, ciprofloxacin, grapafloxacin. All of these may not be clinically used. Some of them may have been withdrawn because of severe toxicity. But if you look at majority of these structures, they will contain a fluorine. So hence fluoroquinolones. So coming to the mechanism of action, what is the mechanism of action of fluoroquinolone group of antibacterial antimicrobials? These fluoroquinolones are inhibitors of bacterial DNA replication. Bacteria needs to divide, and for division to take place, the DNA also needs to replicate. So fluoroquinolones are inhibitors of bacterial DNA replication. How do they inhibit bacterial DNA replication? Who can tell me what are these steps in DNA replication? Do you remember anything from your biochemistry classes? So there are several steps in DNA replication. Where does fluoroquinolones act on bacterial DNA replication? We'll be studying about that in further slides. Anyways, what is the spectrum of activity of fluoroquinolones? Fluoroquinolones are effective in both gram-positive as well as gram-negative bacteria. You can say that these are effective in both gram-positive as well as gram-negative aerobic bacteria. So these are wide spectrum of drugs. These are drugs having a wide spectrum. These are drugs having a wide spectrum because they cover both gram-positive as well as gram-negative bacteria. However, fluoroquinolones are not effective against, not all the members are active against anaerobes. Some member, one or two members may have some activity against anaerobes, but these are generally effective in gram-positive as well as gram-negative bacteria. So they belong to drugs which have narrow spectrum or broad spectrum. What do we call them? Broad spectrum antimicrobials or narrow spectrum antimicrobials? Who can tell me? Broad spectrum. Okay. So they belong to antibacterials which have a broad spectrum of activity. Moving on. Now, the mechanism of action by which fluoroquinolones inhibit DNA replication is by inhibition of these enzymes, important enzymes, by the name of DNA gyrase, which is present in gram-negative bacteria, and another enzyme by the name of topoisomerase 4, which is present in gram-positive bacteria. Why do they have selective toxicity towards bacteria only? Because these similar enzymes, subcategory of this enzyme, which is present in eukaryotic cell, is different. And this, although ho sakta hai sare hi topoisomerases ho, somebody named this topoisomerase, which is present in eukaryotic cells as topoisomerase 2. The topoisomerase, not topoisomerase. They maintain the topology, they maintain the structure, they maintain the spatial arrangement of DNA, the arrangement of DNA in space. So these topoisomerase 2 is present in eukaryotic cells. This is usually not inhibited by fluoroquinolones. That is why they are selectively toxic towards bacteria only. However, topoisomerase 4, which is present in gram-positive bacteria, and a particular topoisomerase which is present in gram-negative bacteria, this topoisomerase is known by the name of DNA gyrase. So this DNA gyrase is inhibited in gram-negative bacteria. Topoisomerase 4 is inhibited in gram-positive bacteria, whereas topoisomerase 2, which is present in eukaryotic cells, is not generally inhibited. So this is a diagrammatic representation of the functionality of these topoisomerases. Topoisomerase 4 क्या कर रहा है? Topoisomerase 4 is involved in the separation of daughter strands, as well as it is separating the parent strands of DNA so that daughter strands can be produced. So you can say topoisomerase 4 is causing separation of daughter strands, whereas DNA gyrase, which is present in gram-negative bacteria, यहाँ पे इन्होंने DNA gyrase बना रखा है, and this DNA gyrase is producing negative supercoiling, so that जब ये parent strains का separation हो, parent strands of DNA का separation हो, there must not be excessive coiling of the remaining of the DNA segment. So this DNA gyrase is inducing negative supercoiling. जिस डायरेक्शन में कॉइलिंग है उसके रिवर्स डायरेक्शन में सुपर कॉइलिंग प्रोड्यूस कर रहा है, कॉइलिंग प्रोड्यूस कर रहा है, सो दैट बहुत ज्यादा टाइटली कॉइल्ड ना हो जाए. सो this DNA gyrase is producing negative supercoiling, whereas topoisomerase 4 is causing separation of daughter strands. Anyways, fluoroquinolones are inhibitors of bacterial DNA replication. How do they inhibit bacterial DNA replication? By inhibiting DNA gyrase in gram-negative bacteria, which causes negative supercoiling, and they act by inhibiting the enzyme topoisomerase 4 in gram-positive bacteria, which is responsible for separation of daughter strands. This is another diagrammatic representation. How are topoisomerases important even in a normal non-dividing bacteria? This is, you can see this strand, circular DNA, circular RNA भी हो सकता है, but let's say this is a closed circular DNA, and this is not binding to itself, this is not coiled, ये आराम से function कर सकता है बैक्टीरिया, इसमें से कुछ भी replication हो सकता है ना? It can replicate easily, it can transcribe into mRNA easily. So the topology is maintained clearly. But अगर ये topology maintain ना हो, तो ये strand आपस में ही फंस सकता है ना? आपस में ही coil up कर सकता है. जैसे घर में रोप पड़ी भी होती है, you do not keep it neatly, cleanly, it has a tendency to get tangled up. So the DNA can get tangled up. So here, the topoisomerases, a group of enzymes responsible for maintaining the topology, they convert this supercoiled DNA into a relaxed topology so that the bacteria can function. If these topoisomerases are inhibited, the bacterial DNA will get coiled up, will get supercoiled, will get tangled up, and there will be no normal function. So fluoroquinolones are inhibitors of topoisomerases, the enzymes which are responsible for maintaining the topology or structure of the spatial arrangement of DNA. Now, what is the mechanism of resistance that bacteria develop to overcome fluoroquinolones? There are several mechanisms, but इसमें कुछ और लिखा हुआ है. There is a unique mechanism of action. Plasmid-mediated resistance is less. Plasmid-mediated resistance towards fluoroquinolones is less, and resistance is due to chromosomal mutation. The bacteria itself produces chromosomal mutation, so it produces a DNA gyrase, this enzyme, or topoisomerase 4, DNA gyrase or topoisomerase 4 with reduced affinity to fluoroquinolone. So fluoroquinolone will not be able to bind to these enzymes and will not be able to inhibit these enzymes. Also, there may be reduced permeability of the antimicrobial fluoroquinolones inside the bacterial cell, or increased efflux of the fluoroquinolone. The bacteria will throw out the fluoroquinolone from inside the cell to outside. So the antibacterial will not be able to produce its desired effect in the bacteria. So these are some mechanisms of resistance. The bacteria, importantly, bacteria start producing these enzymes, DNA gyrase or topoisomerase 4, with reduced affinity towards fluoroquinolone. Moving on. This is again a diagram showing the mechanism of resistance. Resistance mechanism 1 is mutation in bacterial topoisomerase 4 or DNA gyrase, preventing fluoroquinolones from binding, allowing replication of bacterial genome to continue. ये just अभी हमने बोला है ना. And the second mechanism is efflux pumps. Bacterial modification to an efflux pump can allow the bacteria to pump fluoroquinolones out of the cell. So these are two resistance mechanisms by which bacteria produces resistance towards fluoroquinolones. Now, how do we classify fluoroquinolones? Whatever classification is given in your books is good enough for you, whichever book you are following. If you do not know how to classify it, it is again not that important, but this is a simpler classification. First generation and second generation fluoroquinolones. This classification into first and second generation is not based on the time when these antibiotics, these antimicrobials came into existence. This classification is based on the spectrum of activity of antimicrobials and which govern the clinical use towards the type of infections in which they are used. Generally speaking, first generation fluoroquinolones have activity towards gram-positive and gram-negative bacteria and gram-negative bacteria, but the activity towards anaerobes may not be present in first generation. Some second generation fluoroquinolones may have activity against anaerobes. Some second generation fluoroquinolones may have additional activity against additional bacteria as well. If you can remember this. Anyways, fluoroquinolones belonging to first generation include NALIDIXIC, CIPROFLOXACIN, ofloxacin, PHARMACOLOGY and LOMEFLOXACin, whereas those belonging to second generations include LEVOFLOXACIN, FLUoroquinolones, SPARFloxacin, gemifloxacin, and moxifloxacin. Some people may divide this second generation, may further divide the second generation into 3 more generations, and called LEVOFLOXACIN and FLUoroquinolones as second generation fluoroquinolones, SPARFloxacin, gemifloxacin as third generation fluoroquinolones, and moxifloxacin as fifth generation fluoroquinolone, depending on the activity, the increased or decreased in activity. But if you can remember, even this one, some people put LOMEFLOXACIN here, but ऐसा कोई जरूरी नहीं. Some people they start fluoroquinolone classification from NALIDIXIC acid, and they say NALIDIXIC acid is the first generation fluoroquinolone, and accordingly this group will become second generation and this will become third generation, and third generation को आप again subdivide कर सकते हैं. But this is a simpler classification for you for remembering sake. Now moving on, this is again the parent drug structure. Moving on to ciprofloxacin, we are talking about first generation fluoroquinolone, and whenever we start a discussion about a class of drugs, we start with a prototype drug, and then we compare other drugs with the prototype drug. So ciprofloxacin can be considered as a prototype of fluoroquinolone. It is the most potent first generation fluoroquinolone, which is active against a broad range of bacteria, and it is effective against aerobic gram-negative bacteria. This is not effective against, generally speaking, this is not effective against anaerobic gram-negative bacteria. And it is effective against aerobic gram-negative bacteria only. Anaerobes होंगे तो ciprofloxacin is not that useful. Maybe second generation fluoroquinolones, some members of second generation fluoroquinolones may have good activity against anaerobes as well, but ciprofloxacin has activity against gram-positive bacteria as well as aerobic gram-negative bacteria. Coming to pharmacokinetics, ciprofloxacin has good oral bioavailability. Who can tell me what is bioavailability? Who can tell me what is bioavailability? Why do we need to talk about bioavailability? So bioavailability is the, as most of you are answering correctly, it is the fraction of drug that reaches the systemic circulation in the unchanged form. And this fraction of drug which is reaching the systemic circulation in the unchanged form from the site of absorption can be expressed in percentage. जैसे इन्होंने यहाँ पे fraction को percentage में करके लिखा हुआ है that the bioavailability is 85 to 95%. So the bioavailability via the oral route, bioavailability via the oral route is 85 to 95%. So up to 85 to 95% of the drug reaches the systemic circulation in the unchanged form. So it has good oral bioavailability. It is quite effective as a drug via the oral route. However, oral absorption can get decreased by divalent cations, such as calcium or other divalent cations you can think of. Some absorption may be decreased. Overall, ciprofloxacin, the prototype of first generation fluoroquinolone, has good tissue penetration. It has good tissue penetration. So high concentrations are achieved in tissue and they can be given in systemic infection. Now, this is a table showing some pharmacokinetic properties of majority of fluoroquinolones. इसमें आपको first generation, second generation सारी fluoroquinolones मिलेंगी. You can see that majority of fluoroquinolones have good oral bioavailability. And some fluoroquinolones like LEVOFLOXACIN and LOMEFLOXACIN have very, very high bioavailability. Antifloxacin also has 98%, but antifloxacin may not be used these days. It may have been withdrawn, शायद, है ना? पढ़ना है आपको जाके इसके बारे में. And the route of excretion or the route of elimination for majority of fluoroquinolones is renal. Majority of these get eliminated via the kidneys. Moxifloxacin has non-renal elimination. Sparfloxacin has 50% elimination via the renal route, while 50% is removed in feces. So it has gastrointestinal tract as route of elimination, sparfloxacin. So these are some pharmacokinetic properties of these fluoroquinolones. Here, if you can remember anything, it is good. We were talking about ciprofloxacin. Moving on, ciprofloxacin belonging to first generation fluoroquinolones has rapid bactericidal activity. All of the fluoroquinolones are bactericidal in nature. This ciprofloxacin has rapid bactericidal activity and it has high potency. High potency means a small quantity of drug is sufficient to produce good response. You know? A drug having low potency may require larger doses. A drug having high potency will require smaller doses. जब तक kilograms में नहीं चली जाती, grams में नहीं चली जाती, तब तक potency की कोई इतनी importance नहीं होती है. Some drugs may be potent in 1 milligram, some drug may be potent in at 1000 milligram. Tablet का size थोड़ा change हो जाएगा, है, but इससे कोई फर्क नहीं पड़ेगा. But we are talking about ciprofloxacin. It has rapid bactericidal activity, high potency. It has a relatively long post-antibiotic effect. Can you tell me, fluoroquinolones, do they follow concentration-dependent killing or time-dependent killing? Can anyone tell me which kind of antibacterial effect fluoroquinolones produce? Do they produce concentration-dependent killing or time-dependent killing? Yes. So majority of you are correctly answering that they follow concentration-dependent killing. Those who are saying time-dependent killing are not entirely correct, but despite following concentration-dependent killing, इसका मतलब ये नहीं कि आप एक single large dose दे दोगे और आपको repeated dosing करने की जरूरत नहीं है. You will have to give doses at repeated intervals. तो टाइम डिपेंडेंट भी होता है, बट सीटी के कहना इसको करेक्ट है. And those drugs which follow concentration dependent killing, they have a post-antibiotic effect. Post-antibiotic effect, who can tell me what is post-antibiotic effect? Post-antibiotic effect means when the concentration of the antibiotic in the blood decreases below the minimum inhibitory concentration, the antibacterial, the antibiotic effects can still be seen on the bacterium. So, ciprofloxacin, bactericidal activity, high potency, it, it produces antibacterial effect via concentration dependent killing. It also has a long post-antibiotic effect, particularly on bacteria belonging to Enterobacteriaceae, Pseudomonas, and Staph. Some people may say that ciprofloxacin has no activity against Pseudomonas. Some may say it has some activity against Pseudomonas. Depends on the place that you are talking about. What kind of bacteria are you encountering? Sometimes Pseudomonas may show effect towards ciprofloxacin. Sometimes it may not show. Anyways, so ciprofloxacin, first generation fluoroquinolone, bactericidal fluoroquinolone. Majority of all of the fluoroquinolones are bactericidal. This particular ciprofloxacin has high potency. It causes concentration dependent killing. It has good long post-antibiotic effect, and there is low frequency of mutational resistance. So the antibacterial resistance, emergence of antibacterial resistance is not so frequent. इसका मतलब ये नहीं है that you will start using and misusing or overusing this particular fluoroquinolone, this particular ciprofloxacin, this particular drug or medicine by the name of ciprofloxacin. Ciprofloxacin, because it does not affect anaerobes, it does not affect bacteria which are not dependent on the presence of oxygen. It has no effect on protective intestinal streptococci and anaerobes. So these bacteria are spared. Protective intestinal streptococci and anaerobes are spared. So the incidence of gastrointestinal adverse effects like diarrhea, gut test motility may be less as compared to other antimicrobials. And ciprofloxacin is active against many beta-lactamase producing bacteria which produce beta-lactamases, which have become resistant to beta-lactam antibiotics. Ciprofloxacin may be active against many such beta-lactams. Also, aminoglycoside resistant bacteria, those bacteria which have become resilient to aminoglycoside. We will be studying about aminoglycosides after completing fluoroquinolones. This fluoroquinolone is less active at acidic pH. So if the medium is pH, the activity decreases. Now, what are the common adverse effects that you encounter with fluoroquinolones or you encounter with ciprofloxacin, which is a prototype drug? The adverse effects include the adverse overall speaking, fluoroquinolones have very mild adverse drug reactions, have very low incidence of adverse drug reactions. These are generally very safe drugs. They are not associated with serious adverse effects. However, some adverse effects can be remembered. Gastrointestinal GI tract, they can produce nausea, vomiting, anorexia. However, diarrhea is infrequent. Like any other drug, fluoroquinolones, ciprofloxacin can produce hypersensitivity in the form of rash. They may produce headache, dizziness, insomnia when we talk about adverse effects on CNS. And this is the important adverse effect that they can produce. Is there notorious effect? Is there noxious effects? Is there harmful effects on joints and cartilage, particularly in small kids, particularly in kids less than 12-year-old? This has been found in animal studies that they produce reversible arthropathies, tendon ruptures, tendinitis. These tendon ruptures have been encountered in adults also. Reversible arthropathies have been seen in some very few cases. However, when we use fluoroquinolones are usually not given to children less than 12 years old. However, when fluoroquinolones are used in patients of cystic fibrosis, not many such adverse effects are seen, but still their use should be reserved and they should not be used in excess in children less than 12 years old. So these are some adverse effects. इसमें से at least you must remember their harmful effects on joints and cartilages, producing reversible arthropathy, tendon ruptures. they can sometimes produce a particular kind of rash. So where fluoroquinolones like ciprofloxacin is to be avoided, is it contraindicated? So fluoroquinolones are to be avoided in pregnancy and kids less than 12 years of age. Some people can say these are contraindicated in pregnancy. Those are not wrong people. When they are saying these are contraindicated in pregnancy, you must not give fluoroquinolones to pregnant females. You should not give any of these drugs to pregnant females. Norfloxacin, ciprofloxacin, ofloxacin, PHARMACOLOGY, LOMEFLOXACin. All fluoroquinolones end with floxacin. LEVOFLOXACIN, Fluoroquinolones, SPARFloxacin, moxifloxacin. All these should not be used in pregnant females, and they should be avoided in children less than 12 years of age. Another important adverse effect, I'm saying important, I'm not saying very common. Another important adverse effect that may be encountered with the use of some fluoroquinolones is prolongation of QT interval in the ECG. There is QTC interval, and these fluoroquinolones may cause QTC prolongation, and these are to be avoided in patients who are prone to serious cardiac arrhythmias, ventricular arrhythmias, patients taking other kinds of drugs which are known to produce QTC prolongation. Can anyone name any drug which produces QTC prolongation? Cipride, सही बात है. Yes. So there are drugs which produces QTC prolongation, and patients should not be prescribed fluoroquinolones when they are taking other drugs which are known to produce QT prolongation. These should not be prescribed in patients prone to ventricular arrhythmias. So ऐसा भी हो सकता है. So it is to be used with caution. It is contraindicated in pregnant females. It is not to be given. It is contraindicated in kids less than 12 years of age, and it is not to be given in people who are prone to ventricular arrhythmias and people taking drugs for whatever condition which can cause QT prolongation. This is a diagram showing, on the left side it is showing a fluoroquinolone induced rash. Hypersensitivity, I said they can cause hypersensitivity. So this is a diagram. This is a kind of rash which is produced by fluoroquinolone. And on the right side, this is the Achilles tendon. And foot diagram है. This is the heel. इसके toes आगे की तरफ होंगे. ये शायद medial या lateral malleolus है ना. Foot ऊपर की तरफ सीधे खड़ा हुआ है, ऊपर इंसान होगा. है ना. This is the Achilles tendon. This Achilles tendon is showing small swelling, fusiform swelling. Fusiform is just a shape. It is fusiform in shape. Swelling that indicates a partial tear in the Achilles tendon. So these are prone to produce. These can produce. Fluoroquinolones can produce tendon rupture, tendinitis, reversible arthropathies. So these are some adverse effects. Coming to drug interaction of fluoroquinolone group of drugs. What drug interactions do they produce? Are there important drug interactions which should be remembered? कुछ हो सकते हैं, है ना? Food and antacids and iron. Food antacids contain divalent cations. Iron, divalent or trivalent, may combine with fluoroquinolone and thus decreases the absorption of fluoroquinolone. By decreasing the absorption of fluoroquinolone, the concentration of fluoroquinolone in the blood will decrease, and there may be therapeutic failure of the antimicrobial fluoroquinolones with the use of food antacids and iron. फ्लोरोक्विनोलॉन्स खुद क्या कर सकते हैं? सिप्रोफ्लॉक्सासिन डायग्राम में अगर आप देखें, सिप्रोफ्लॉक्सासिन, ओफ्लॉक्सासिन, इनोफ्लॉक्सासिन, these are inhibitors of cytochrome P450. Cytochrome P450, which is the main enzyme responsible. इसके भी subtypes होते हैं. This is a super family of enzymes with so many subtypes. Cytochrome P450 is responsible for metabolism of so many drugs. So the important drugs whose metabolism is inhibited by fluoroquinolones. Fluoroquinolone is an inhibitor of cytochrome P450. Some important drugs whose metabolism is inhibited by fluoroquinolones include theophylline, warfarin, and cyclosporin. So theophylline, caffeine, they belong to same family. Theophylline and caffeine belong to methylxanthines. Warfarin or cyclosporin, their concentration may increase due to enzyme inhibition produced by these fluoroquinolones. So serum concentration of these drugs will increase. If the serum concentration of theophylline will increase, what will it produce? Can anyone tell me? Theophylline belongs to a group of drugs which has narrow therapeutic index or wide therapeutic index. Is it prone to produce serious cardiac and CNS effects? It belongs to narrow therapeutic index drugs. So it reduces as soon as the concentration increases twice or 4 times, it will start producing serious side effects. So it has a narrow therapeutic index. If the concentration of warfarin increases, what will be the effect? Will there be increased bleeding tendencies in patient or not? So ये हो सकता है ना? Because fluoroquinolones are enzyme inhibitors. And another important adverse drug reaction, another important drug interaction, sorry, not adverse drug reaction, another important drug interaction which may be remembered is CNS toxicity. NSAIDs may increase CNS toxicity. CNS toxicity of fluoroquinolones. But आप देखेंगे कि NSAIDs like paracetamol, ibuprofen, diclofenac, so many NSAIDs are commonly used along with fluoroquinolones. But there are chances that NSAIDs may increase CNS toxicity and seizures may occur. Itna common nahi hota, and you will always use, majority of the time you will be using fluoroquinolone like ciprofloxacin along with NSAIDs. NSAIDs तो आपको देने ही पड़ेंगे fever का patient होगा तो, है ना? Infection है, fever है, उसके लिए आप NSAIDs देंगे. But this is to be remembered that sometimes NSAID may precipitate CNS toxicity. So these are some drug interactions which may be asked, which may not be asked. You may encounter them in real life. तब आपको शायद याद आए कि यहाँ से कुछ पढ़ा था. Moving on to the therapeutic uses. Where are fluoroquinolones used? Fluoroquinolones are used in a large number of cases, in a large number of conditions. Commonly used in urinary tract infections. They can be used in multiple drug-resistant pseudomonas, UTI pseudomonas से हो या और कोई infection हो, ये शायद combine करके. These are the usual doses. Ciprofloxacin 500 mg/d, NALIDIXIC 400 mg/d. Ofloxacin can be used in this concentration. Fluoroquinolones are also useful in bacterial dysentery caused by Shigella, Salmonella, E. coli, Empilobacter. Fluoroquinolones like ciprofloxacin or any other fluoroquinolone is very useful in people suffering from typhoid fever. Typhoid fever कौन करता है? You can tell me what is the causative agent of typhoid fever? Salmonella type B. Salmonella, okay. Salmonella causes typhoid fever, and ciprofloxacin or other fluoroquinolones are useful in typhoid fever also because they produce quick effervescence, early abatement of symptoms, and prevention of carrier state. Moving on to the therapeutic uses, fluoroquinolones like ciprofloxacin and other fluoroquinolones are useful in management of sexually transmitted diseases, sexually transmitted infections, venereal diseases such as chlamydia, chancroid, and pelvic inflammatory disease. This is the duration of treatment which is usually required for management of conditions. They are also useful in bone and soft tissue infections where fluoroquinolone is combined with metronidazole. Metronidazole शायद आपको अभी पढ़ाएंगे इसके बाद. Fluoroquinolones are useful in respiratory infections, both upper and lower RTI. Do not use them for viral infections. Use them for upper and lower respiratory tract infections caused by bacteria, caused by sensitive bacteria. Another important use of fluoroquinolones is in tuberculosis. Certain agents like levofloxacin are very useful in the management of tuberculosis, particularly in resistant atypical cases. Fluoroquinolones are also useful in septicemias, meningitis, neutropenic patients, conjunctivitis, eyes में directly instill करेंगे in the form of eye drops. है ना, कंजंक्टिवाइटिस के लिए आप उसको सिस्टेमिक भी नहीं देंगे, दे भी सकते हैं, आपकी मर्जी है ना, आप डॉक्टर बन जाएंगे थोड़े दिन के बाद, आपकी मर्जी चलेगी. This is just a diagram showing the fluoroquinolone uses. Intravenously भी दे सकते हैं, orally भी दे सकते हैं. These are the routes by which fluoroquinolones are useful. Mechanism बताया आपको. Infections, inhaled anthrax, one emerging use of ciprofloxacin and other fluoroquinolones is in bioterrorism, where anthrax spores are inhaled by people, and ciprofloxacin or other fluoroquinolones are useful. They can be given in patients of prostatitis and UTIs caused by multiple drug-resistant strains. These are certain adverse drug reactions, tendon rupture. Not to be given in children. इन्होंने यहाँ पे 18 लिख दिया, पहले हमने 12 लिखा था, 12 से कम पे तो नहीं दीजिए. Why are these contraindicated in pregnancy? They belong to category C of teratogenic drugs. What is category C? If you can know about this category C, अच्छी बात है. Another important adverse effect, photosensitivity. नीचे किसी ने लिखा photosensitivity छुप गया है ना. Some agents may produce more phototoxicity than other. Now, moving on to the next drug. After talking about the prototype drug, after talking about the mechanism of action, spectrum of activity, adverse drug reaction, clinical uses, drug interactions of fluoroquinolones, we are now going to talk briefly about some members of fluoroquinolone group of drugs and some important points. If you can remember, then fine. Norfloxacin. Norfloxacin is less potent than ciprofloxacin. इतना कोई फर्क नहीं है. It attains lower concentration in tissues. That is an important point. It is used in UTI, dysentery, other places where ciprofloxacin is used. Norfloxacin can also be used. Pfloxacin. Pfloxacin is a methyl derivative of norfloxacin. Some important properties about pfloxacin is that the passage in CSF is greater than in other tissues, so it has a tendency to accumulate in brain. You can use this property for attaining higher CSF concentration, but then this will also cause accumulation in the tissues, particularly in CSF on longer duration, on treatment for long duration of time. So this can be used or this can also lead to certain adverse effects. This particular fluoroquinolone has longer T-half and it has a tendency to accumulate. And it is effective in systemic as well as local infection. Now moving on to ofloxacin. Ofloxacin के दो congeners हो सकते हैं, dextro and levo, and somebody may have isolated levo isomer and started calling it levofloxacin. Anyways, the ofloxacin, we are only talking about ofloxacin. Ofloxacin belong to first generation fluoroquinolones. Whereas levofloxacin belongs to second generation. So there must be some good properties of levofloxacin. इसीलिए किसी ने levo isomer of ofloxacin को isolate कर दिया. Anyways, talking about ofloxacin. Ofloxacin is less active than ciprofloxacin against gram-negative, and it is equally or more potent against gram-positive as well as anaerobes. So it may have activity against anaerobes as well. It has activity against anaerobes as well. You can combine it with other drugs having activity against anaerobes. Ofloxacin is used in chlamydial infections, TB, leprosy, etc. And it is comparable to ciprofloxacin in therapy of systemic and mixed infections. Now, moving on to next fluoroquinolone, LOMEFLOXACIN. It is equal in activity to ciprofloxacin. However, ciprofloxacin is usually given twice daily. LOMEFLOXACIN, because of its longer T-half, can be given by a single daily administration. A bad point about LOMEFLOXACIN is that it has high incidence of phototoxicity and it has high incidence of reducing QT prolongation. So, use judiciously. Do not use in people who are taking drugs causing QT prolongation, who are prone to develop arrhythmias, who are patients who are on antiarrhythmic drugs. तो आप उसमें LOMEFLOXACIN ना use करें. Is LOMEFLOXACIN still used clinically? Yes. शायद बंद हो गया अब देना आप पढ़ के बताइएगा. Now coming to LEVOFLOXACIN. LEVOFLOXACIN, second generation fluoroquinolone. It is the active levo isomer of ofloxacin having very good oral bioavailability. 95% शायद slide में लिखा होता है, या किसी ने 100% ही लिख दिया. So it may have 100% oral bioavailability. It is useful in community-acquired pneumonia. It is useful in chronic bronchitis exacerbation. Other uses of levofloxacin. You can remember the use of fluoroquinolones जो हमने initially आपको बताया था CIPROFLOXACIN के time पे prototype drug पढ़ाते हुए. Because it can be used in community-acquired pneumonia. It is used in chronic bronchitis exacerbation. You must remember that levofloxacin, like any other floxacin, has activity against tubercular bacteria. But if you give a patient of TB only fluoroquinolone like levofloxacin, it will suppress for the time being. It will only suppress for the time being, and it will come back without vengeance. So you can only hide the bacteria for so long. And in tuberculosis, a number of drugs are to be used for the management. Multiple drugs are to be used so that TB can be controlled. So levofloxacin used in patients having respiratory tract infections, such as lower respiratory tract infections, reducing productive cough for longer duration of time. In such patients, levofloxacin use should be avoided. Such patients who are having chronic cough, chronic sputum, may be suffering from TB, and the diagnosis of TB may be missed. That symptoms may be suppressed for a brief period of time by this levofloxacin. However, it is used in community-acquired pneumonias and chronic bronchitis exacerbation along with other uses. But you must be on the lookout for TB when you are living in India. You should be on the lookout for TB. If the patient, you think the patient is suffering from TB, diagnose TB correctly. Correct the start management for TB. If you want to use levofloxacin, yes, you can use levofloxacin in a patient of tuberculosis, but levofloxacin is not used alone. It is used with other combination of drugs. So सिर्फ levofloxacin मत दीजिए TB के patient को. What is moxifloxacin? It belongs to second generation, just like levofloxacin. It has activity against strep pneumoniae and gram-positive, including beta-lactam and macrolide resistant bacteria, as well as anaerobes. So spectrum activity थोड़ी सी increase हो जाती है. Common uses include pneumonias, bronchitis, sinusitis, otitis media. Gemifloxacin. Gemifloxacin is another second generation broad spectrum fluoroquinolone commonly used in these conditions, just like levofloxacin. It is prolefloxacin. Prolefloxacin is a prodrug of ulefloxacin. It is a second generation fluoroquinolone, prodrug of ulefloxacin. It has broad spectrum, and these are common clinical uses. Now, some fluoroquinolones have been banned or withdrawn from the market. Few of these include catifloxacin, sparfloxacin, dimafloxacin, trovafloxacin, grapafloxacin, and clinafloxacin. These are certain adverse drug reaction. हो सकता है इनका incidence ज़्यादा हो सकता है इन adverse drug reactions की fatality ज़्यादा हो, severity ज़्यादा हो. That's why these fluoroquinolones have been banned. Catifloxacin has been banned because it has tendency to produce dysglycemia. यहाँ पे इन्होंने hypoglycemia लिखा है because hypoglycemia in an acute setting is more dangerous than hypoglycemia. So it may have been withdrawn because of dysglycemia, because of hypoglycemia. However, another important adverse effect that catifloxacin used to produce was QT prolongation. So if you want to remember why they have been withdrawn, if you want to remember what fluoroquinolones have been withdrawn, ये सारी fluoroquinolones have been withdrawn. कुछ reasons उनके withdrawal के from the market ये लिखे हुए हैं इसमें, है ना? इसमें thank you आ गया, but जाने से पहले 2 minutes. I'll give you a break for 5 minutes, but let's see how many of you are still listening. We are going to launch a poll. We are going to ask you a few questions. So